If you are coming to the hospital for surgery, you might have questions about what's going to happen that day. Here, we will walk you through what happens before and after your surgery. You will also see some of the people you will meet that day. Going through surgery is a new and different experience. Remember, you can always ask questions to any of our staff members. The first thing you and your parents will do when you get to the hospital is visit the check-in desk to let us know that you're here. If you are already here at the hospital, one of our staff members will take you from your unit to the OR, or operating room. After you check in, you and your parents will wait for the nurse to call your name. Once the nurse calls your name, he or she will take you to the pre-op room, where you will do a few things to prepare for surgery. First, the nurse will place a wristband on one of your wrists. This way, everyone will know your name. Next, he or she will check your temperature. Some kids say that taking your temperature feels like a little tickle. The nurse will place a little clip called a pulse oximeter on your finger. Don't worry, it doesn't hurt. The nurse will also place a band called a pressure cuff around your arm or leg. All you have to do is hold still. Next, you will change out of your clothes and into a hospital gown. Everyone in the OR wears clean scrubs or hospital gowns to keep germs out. Now, the nurse will ask you to step on the scale to see how much you weigh. He or she will also use a stethoscope to listen to your heart and lungs. You may drink some medicine to help you relax before your surgery. If you are already staying at the hospital, you may get medicine through your IV. Our Child Life team may be with you that day. They can answer questions, do fun activities with you, and find ways to help you relax. Don't be afraid to ask questions. If you are worried about something, let us know. Before surgery, you will meet an anesthesiologist who will talk to you and your parents about ways to help you fall asleep during surgery. You and your parents will also talk to your surgeon. If you are already staying at the hospital, you will probably meet the surgeon the day before your surgery. Our team will take you to the operating room in your bed. You can bring your favorite toy to keep you company or your own electronic device to help you relax. When you're all ready to go into the OR, you can hug your parents and tell them you'll see them after surgery. This is what the OR looks like. There will be bright lights, monitors, and many people in the room to help you with your surgery. An OR nurse will take care of you while you're here. Everyone who is helping you with surgery will put on their caps and masks. The room might be noisy. You may hear machines or music playing. The doctors might raise your bed higher, and you may need to move to a new bed. The room might be cold, but your OR nurse will get you a warm blanket. They will also put a seatbelt on you to help you hold still while you're sleeping. The OR team will connect your pulse oximeter and put the blood pressure cuff back on your leg or arm. They might ask you for your name or ask to see your wristband. They will also put some stickers on your chest to check your heartbeat. These stickers will probably feel a little cold. After that, the anesthesiologist will help you fall asleep. They may give you medicine through a mask. The medicine that comes through the mask might smell funny. You can still breathe and talk with your mask on. Some kids even like to sing. If you already have an IV, the anesthesiologist will help you fall asleep by injecting medicine through it. You will be in a deep sleep and nothing will wake you up until your surgery is over. So relax and sweet dreams. When you wake up, you will be in a room called the recovery room. You might still feel sleepy and your vision might be a little blurry. You will still have monitors on your body when you wake up. Also, you may have an IV so they can give you medicine if you're feeling sick or in pain. You will stay in the recovery room while you're waking up. Your parents will be there soon after. If you are thirsty or your throat feels scratchy, you can ask for ice chips or cold water. If you're staying in the hospital overnight or longer, you will keep your IV in until you're ready to leave. Getting your IV out feels the same as taking off a Band-Aid. We also have games and activities you can play if you're staying overnight. When it's time for you to go home, we will use a wheelchair to take you to your car. Remember, you can always ask questions. Our team is here for you.